Hi, my name is Emily Brownell. I'm an MSc student in the Department of Community Health Sciences at the University of Manitoba, and today I'm presenting on my thesis work, First Nations Women's Perinatal Care Experiences in Northern Manitoba, a multi-method study. Indigenous peoples in Canada include First Nations, Inuit, and Métis peoples. Approximately 46% of Indigenous women in Canada live in rural and remote areas. Women living in these areas have higher birth rates than those living in urban areas, and often experience barriers when trying to access perinatal health care. Indigenous women and babies in Canada experience a disproportionate burden of adverse birth outcomes, including preterm births, large for gestational age births, stillbirth, infant death, neonatal death, and postnatal death. In Manitoba, the mortality rate of First Nations infants is double the mortality rate of non-First Nations infants. Many First Nations women are forced to leave their communities for labor and birth due to Health Canada's evacuation policy. Evacuation for birth has many adverse effects, including physical, psychological, and emotional effects for mothers, adverse birth outcomes for infants, emotional and financial effects for families, and loss of knowledge transmission and cultural practices in communities. My research objective is to better understand the experiences of First Nations women in northern Manitoba with healthcare during pregnancy and the year following birth, in order to deconstruct racist aspects of the healthcare system. I will use Indigenous methodologies to document and understand First Nations women's experiences with healthcare during the perinatal period, and I will use Western methodologies to validate a patient-reported experience measures, or PREMS instrument, regarding perinatal healthcare. My project is a multi-method study embedded within a broader initiative being done in partnership with the Northern Health Region, the Keewatin Tribal Council, and First Nations communities. This initiative is titled Facilitating Transitions and Access Across the Pregnancy Continuum of Care, a health system intervention for Indigenous women living in northern Manitoba. On the right-hand side of the poster, you will see the collective impact network that was created as part of this initiative, with many different groups involved, but with women and their families and communities at the heart of the project, as is also true in my work. For this project, I will apply a two-eyed seeing approach, utilizing strengths of Indigenous and Western ways of knowing. Although the women involved in the research are navigating a Western colonial healthcare system, they bring vital knowledge from their experiences as Indigenous peoples living in Manitoba's north, and privileging this knowledge is critical in order to gain a richer understanding of their experiences in the system. I will use the Indigenous method of sharing circles with three groups in northern Manitoba: First Nations mothers, First Nations elders, and healthcare practitioners. These circles will be co-facilitated by an elder and myself, and will incorporate ceremony. Participants will be partners in the analysis and interpretation of the data, leading to greater documentation of their lived social reality and capturing a range of perspectives. Experiences will be presented as stories to avoid fragmentation and decontextualization. I will use Western methods to conduct a validation study of 4 PREMS questionnaires designed to measure women's experiences with the healthcare system. I will conduct face validation and pre-testing of the questionnaires to ensure that they appear to measure the intended construct and that questions are being correctly interpreted by a sample of the target population. I will then conduct item reduction using exploratory factor analysis to identify how many underlying factors are necessary to explain any existing interrelationships among the questionnaire items. Finally, I will test validity using confirmatory factor analysis, internal consistency reliability using Cronbach's alpha, and test-retest reliability using the intra-class correlation coefficient. Results are pending. The findings from the sharing circles will be used to help better illustrate the experiences captured using the PREMS instruments. Discussions with Indigenous women, elders, and healthcare practitioners from northern Manitoba throughout the Facilitating Transitions grant have made clear that First Nations women experience a great deal of racism in the current healthcare system. Through the work being done as part of my thesis, First Nations women's experiences will be fed back to the Northern Health Region and to First Nations communities and organizations, with the aim of deconstructing racist aspects within the healthcare system. By documenting mothers' voices in partnership with First Nations communities and organizations and with the healthcare system, findings will be positioned to positively impact pregnancy care, leading to improved outcomes among First Nations women and children. Thank you for listening to my presentation on First Nations women's perinatal care experiences in northern Manitoba.